I'm Brad Carofino. I'm an orthopedic surgeon in Virginia Beach, Virginia. I specialize in shoulder and upper extremity surgery. One of the things in particular that is a large portion of my practice is shoulder replacement surgery. I have specialized training in the Ream and Run surgery, which is a type of shoulder replacement for patients who are younger or those who are wishing to maintain an active lifestyle. As a result, I've had patients coming to me from throughout the East Coast and the Midwestern portions of the United States for Ream and Run surgery. And I've even had patients contact me from outside of the United States looking for information about the Ream and Run. I wanted to put together a video that will answer most of the questions that patients tend to have when they're evaluating whether or not this is an appropriate surgery for them. At the end of this talk, if you have more questions about whether or not Ream and Run shoulder replacement might be appropriate for you, you can email me at the email listed above, or you could visit my website where I have additional information about shoulder conditions, including the Ream and Run. The Ream and Run is a type of shoulder replacement which is really designed for younger individuals who are wishing to maintain an active lifestyle, or even older individuals who are very active. The Ream and Run avoids implanting a plastic socket as is done in a typical shoulder replacement. And instead of putting in a plastic socket, the patient's own bony socket is reshaped so that it will fit with the ball of a shoulder replacement. In addition to reshaping the socket, it also stimulates the socket to regrow a sort of scar cartilage surface. Avoiding implantation of a plastic socket offers advantages to younger patients who otherwise would have to significantly modify their activities if they had a standard shoulder replacement. This talk will cover the basics of shoulder arthritis. We'll then review a standard total shoulder replacement, followed by a discussion of the Ream and Run replacement. Finally, we'll compare the pros and cons of both a total shoulder replacement and a Ream and Run, so that hopefully you'll have all the information to decide which operation best suits your needs. At the outset of this talk, I would like to acknowledge Dr. Rick Mattson, who is the originator of the Ream and Run surgery. He is a shoulder surgeon at the University of Washington in Seattle. He's been a thought leader in shoulder surgery for over 40 years. I was lucky enough to have the opportunity to do my shoulder fellowship under Dr. Mattson, and also he has kindly allowed me to use many of the images in this talk. Let's start by reviewing normal anatomy. The shoulder is a ball and socket joint. The ball is called the humeral head and the socket is called the glenoid. Both of those surfaces are covered by cartilage, which is a very smooth surface. You can see in the x-ray below how there's a nice space between the ball and the socket, and that's where the cartilage resides. In the picture on top, you can see a normal humeral head, and that's covered by that cartilage surface. So as a normal shoulder moves and rotates, you have those smooth surfaces of the cartilage on the humeral head and the glenoid essentially gliding on each other. In shoulder arthritis, that cartilage surface wears away. So now you have a situation where there's bone on bone. In the picture on the left, you can see a humeral head, and now instead of having that smooth cartilage covering, there's exposed bone. In the x-ray on the right, you can see the loss of joint space between the ball and the socket, again bone on bone, and also large bone spurs have formed. A total shoulder replacement is really the gold standard operation for treatment of shoulder arthritis. In a shoulder replacement, the ball of the shoulder is replaced with a metal ball, and the socket of the shoulder, the glenoid, is covered with a plastic socket. Generally speaking, total shoulder replacements give excellent results. Patients can anticipate significant pain relief, improvement in function, and improvement in range of motion. So if total shoulder replacements work so well, why is there a need for an operation like the Ream and Run? And the answer to that is, it's all about the socket. The problem with total shoulder replacements is that the plastic socket tends to wear out over time, and furthermore, it tends to come loose from the bone over time. Total shoulder replacements have a failure rate of approximately 1% per year. And generally, this is because of socket failure. This means that 10% of shoulder replacements generally will fail by 10 years, 20% by 20 years, and so on. Clearly, that's a problem for a younger patient who's in their 40s or 50s. The second issue with shoulder replacements is that they're not meant for heavy activity. And again, that's because the socket really isn't able to withstand heavy activity. Patients are encouraged not to do any heavy lifting or anything that places a repetitive load across the shoulder. That also is a problem for younger patients or active patients. So now let's talk about the Ream and Run replacement. As I mentioned previously, the Ream and Run replacement is a type of shoulder replacement that avoids putting in a plastic socket. The ball of the shoulder is still replaced with a metal ball, but now the socket, instead of being replaced with a plastic socket, is reshaped so that it fits well with the ball. And furthermore, in the process of reshaping the socket, it is stimulated to grow a scar cartilage, which will form a new bearing surface. The main advantage of the Ream and Run is that by avoiding the plastic socket, there's no activity restrictions. Patients can do and lift whatever they're able to do, and later you're going to see a video of a patient of mine doing some heavy bench pressing. Also, we can avoid the issue of plastic socket failure, so younger patients who might need a shoulder replacement to last them for 40 or even 50 years can do so without the concern of that plastic socket failing. Here's an example of how the Ream and Run is applied. In the x-ray above, you can see that this patient has bone-on-bone arthritis of the shoulder. And furthermore, the socket has become misshapen so that the ball is essentially sitting in only a portion of the socket. In a Ream and Run replacement, that ball is still going to be replaced with a metal ball, but now the socket is going to be reshaped so that it matches up nicely with the ball, and so that the ball becomes recentered in the socket. And you can see on the pictures to the right how specialized reamers are used to reshape that socket. By reshaping the socket and recentering the ball in the socket, the contact area between the ball and the socket is increased, and therefore the stress experienced by the socket is decreased. Now you can see that same shoulder after the Ream and Run has been performed. The ball is now centered in the socket. There is a broad surface area between the ball and the socket, which decreases the contact stress. Also in this x-ray you can see a thin clear space between the ball and the socket, which is where the scar cartilage has regrown. Looking at this again in a picture form, most shoulders that have arthritis have gotten to a point where the ball has worn down an aspect of the socket and is no longer centered in the socket. In a Ream and Run, specialized reamers are used to reshape the socket and to reestablish a good relationship of a centered ball in the socket. One of the other potential advantages of the Ream and Run is that it may stimulate cartilage to regrow on the socket surface. Here you can see a picture of a human socket after the Ream and Run has been performed. You can see that areas of small bleeding bone have been established. This bleeding bone can, in some cases, lead to reformation of a cartilage surface over the socket. This concept has been previously tested in a series of animal experiments by Dr. Mattson and his team at the University of Washington. Here you can see a slide of a normal canine shoulder socket. You can see the bone, which has a bluish appearance, and the cartilage covering on the top, which is red. After the socket has been prepared by reaming and the cartilage is gone, you then see over a period of approximately 20 weeks that cartilage surface regrows and that red layer on top of the bone reforms. Cartilage regrowth on the glenoid has also been seen clinically in patients. Here you can see two x-rays of a patient who has had a Ream and Run shoulder replacement. On both views, it's clear that a joint space has reformed between the bone on the socket side and the prosthetic humeral head. There is a clear space which is identified here by the red arrows. Publications show that approximately 50% of patients that undergo a Ream and Run surgery will have a restoration of joint space, which can be seen on their X-rays. So some patients likely regrow that cartilage, but not all. Another interesting point is that the research studies show that there is no correlation between whether that joint space reforms and the patient's clinical result. Meaning, a patient who does not regrow the joint space may still have an excellent outcome. So the advantages of the Ream and Run surgery are that the patient can avoid implantation of a plastic socket and thereby can avoid a lot of the complications that come along with a plastic socket, such as potential failure of the socket in the future. Patients can also avoid the activity limitations that are associated with a socket, such as no heavy lifting and repetitive activity with the shoulder. To that point, here is a list of things that you shouldn't do with a Ream and Run replacement. And as you can see, there's nothing listed. And that's because patients are allowed to do absolutely anything that they're able to do. If somebody wants to return to heavy working out, such as bench pressing, if they'd like to run a jackhammer, dig ditches, kayak, mountain climb, really anything that they're able to do, they can do. And the reason is because there is no concern about a plastic socket wearing out and failing. To that point, in the next clip, you're going to see one of my patients who was approximately 3.5 months out from a Ream and Run shoulder replacement, and he returned to heavy bench pressing. He's a slightly older individual. He's in his 60s. And for many surgeons, a patient in their 60s would get a total shoulder replacement. But for this particular patient, he was passionate about working out and lifting weights, and lifting heavy weights in particular. So really the Ream and Run replacement was the only operation that would allow him to continue to do that.
Go ahead.
This is Gary Edwards. I had a Ream and Run October the 11th. This is January the 24th. I'm doing 225 for 5 on the bench.
Now, there are also some definite disadvantages to the Ream and Run replacement. In particular, the recovery from a Ream and Run is harder than a recovery from a standard total shoulder replacement. It tends to hurt more during the early periods after surgery. More patients after a Ream and Run tend to struggle with stiffness compared to patients who have had a total shoulder replacement. Along the same lines, more patients who have undergone a Ream and Run tend to have a second surgery during the first 2 years to either address continued pain or difficulties with stiffness. And I'll go through these points in more detail. So if we look at a graph of the recovery after a Ream and Run compared to a total shoulder replacement, here you see patients that have had a total shoulder replacement are graphed in red, and patients that have had a Ream and Run are graphed in black. And this is taken from one of Dr. Matson's publications of his series of patients. The first thing to point out is that long term, the outcomes are the same. So that's good news for a Ream and Run. Patients really do just as well as with a total shoulder replacement. However, it really takes upwards of 2 years for Ream and Run patients to get to the same level as a total shoulder replacement. Furthermore, we can see that there's some definite differences between the Ream and Run replacement patients compared to the shoulder replacement patients during the early time periods, in particular during that 6 month to 1 year after surgery. Patients with total shoulder replacements are definitely doing a little bit better at those time points. Although the early recovery after a Ream and Run replacement is more difficult, the majority of patients still get an excellent result. And so the publications show that approximately 80 to 90% of patients that have had a Ream and Run have a clinically significant improvement in their symptoms. And that's basically the same as the results from a total shoulder replacement. Of course, there are some patients who don't improve from surgery. And unfortunately, there's even some patients who get worse as a result of surgery. That's really the truth of any operation, including a standard total shoulder replacement. So again, in the literature, there was an approximately 6% rate of patients feeling as though they got worse from a Ream and Run surgery. That also is essentially the same as what we see with total shoulder replacements in the literature. The long-term outcomes of a Ream and Run replacement are also very similar to those of a total shoulder replacement. There is only one research study that has looked at the long-term outcomes of this surgery, and that was a research publication by Dr. Matson with an average follow-up of 10 years. In that study, they found that 12% of Ream and Run patients required a revision during the 10-year period, either to a total shoulder replacement or with a re-reaming. That's very similar to what we see with total shoulder replacement patients, and in that study, they referenced a recent article that showed a 15% revision rate for total shoulder arthroplasties during a 10-year time period. One of the things that was very interesting and promising is that the need for revision decreased with time. The majority of the revisions actually happened during the first 2 years after surgery. For patients who made it out beyond 2 years, their likelihood of needing a revision decreased. This is very different than what we see with total shoulder replacement patients. In a total shoulder, the need for a revision increases with time as the plastic socket begins to fail. So this 10-year publication is promising because it suggests that patients that have a good result after 2 years and 5 years have a high likelihood of not needing a revision in the future. Now, as I mentioned before, the main drawback with a Ream and Run replacement is that some patients will struggle during the early time period, in particular those first 2 years. It's been shown that approximately 10 to 15% of patients will undergo a second surgery during the first 2 years. Now, that second surgery is usually done for one of two problems: either stiffness, in which case patients might undergo a manipulation or a capsular release procedure to remove scar tissue, or continued pain. And patients that have continued pain may require conversion to a total shoulder replacement, or in some situations may benefit from a redo of their Ream and Run. This early rate of revision surgery, that 10 to 15% rate within the first 2 years, in my opinion, is definitely higher than what is seen in patients that have a total shoulder replacement with a plastic socket. So for me, the take-home message from the literature is that patients who have a Ream and Run have a harder time during the first 2 years. A percentage of them will require a second surgery to address this, either for stiffness or pain. However, if they're able to obtain a good result, their long-term result will be as good as a shoulder replacement, and they may have a lower risk of future revision surgeries because the revision rate of the Ream and Run tends to drop off long-term, whereas the revision rate of the total shoulder replacement increases long-term. So finally, we get to the important part. Is the Ream and Run surgery right for you? I think the answer to that is for each individual to critically evaluate what their goals are. Are your goals to resume high demand activities such as lifting weights, heavy duty manual labor? If those are things that are essential to you or things that you're passionate about, then a Ream and Run replacement is probably a better option. On the other hand, if you don't engage in any high demand activities, and if your primary goal is simply a quick recovery with predictable pain relief, then a standard total shoulder replacement might be a better option for you. So in some regards, you need to pick your poison. With a Ream and Run, the early recovery is harder, it tends to hurt more initially, it requires a real dedication to physical therapy, and as I've mentioned, there's a higher rate of problems during the first 2 years. However, for patients that make it through that difficult period, there are some real benefits. There's no activity limitations. Patients can do whatever they're able to do, whatever they want to do. And there's a decreased likelihood of needing a revision surgery in the future. Now, with the standard total shoulder replacement, the recovery is definitely easier. It hurts less, there's a more immediate pain relief, more immediate gain in function. Now the downside is that there's a higher revision rate in the future, because as time goes on, it is more and more likely that that plastic socket is going to come loose. Furthermore, it requires a significant activity modification. Patients should not be doing any heavy lifting or anything that places significant repetitive stresses across the shoulder joint. So good luck as you make your decision in terms of what type of shoulder replacement is correct for you. I'd encourage you to choose wisely. Really reflect on what's important to you, what are your goals for surgery, and try to match those up with which operation suits you best. If you have any further questions about the Ream and Run, you can certainly contact me at the email which I provided in the beginning, or you can visit my website.